Hello everyone, welcome to Medicare 101, and whether you're turning 65 for the first time or trying to get some more Medicare information, you are in the right place.
So without further ado, we're going to jump right into it. This is the foundation of Medicare. This is original Medicare. This is where Medicare began, and if you're taking notes, this is where you need to start. So Medicare, the foundation, Part A and B. Part A and B, there's a lot of letters today, but Part A and B is the ones we're going to keep coming back to. Part A is going to be your hospital. That is going to be your hospital coverage. So we think of Part A, that's anything inpatient in a hospital. Part B, that's going to be your doctor coverage. That's anything at an outpatient facility, your family doctor or specialist, that's going to fall under Part B. Part A, that's going to be considered free. Okay, that is what we paid into. You see it in your taxes during your working years. That's what we paid into during our working years. As long as you worked 40 quarters or had a spouse work 40 quarters, you will not pay anything for Part A. If you did not work 40 quarters or you didn't have a spouse work 40 quarters, very rare, but we can help you walk through that situation as well. Part B now, common misconception, Medicare is not free. Part B comes with a premium. The standard premium in 2026 is $202.90. If you're a high income earner, you'll pay more. If you qualify for extra help, you may pay less, but most people are going to pay $202.90 a month. Now, when it comes to enrollment, there's a handful of enrollment scenarios when you're going on to Medicare, and I urge you to identify which one applies to you. And we're going to do a deep dive into each one of these scenarios, but a quick overview. Scenario one, this is the easiest one. You're currently receiving Social Security benefits. Scenario two, you're not receiving Social Security benefits. And scenario three, you're still working. So go ahead and identify which one applies to you, and now we're going to go over each one. So scenario one here, like I said, this is the easiest one. If you're currently drawing Social Security, well, you're automatically going to be enrolled into Medicare. You're going to get your red, white, and blue card about 3 months before you turn 65, and pretty much you're in good shape. If you don't want to be enrolled in Medicare, we have to disenroll you or send that card back, and we can help walk you through that. Scenario two, you're not drawing Social Security. Okay, so let's say you're not drawing Social Security benefits and you want to enroll into Medicare. Well, here's how you do it. We need to do it manually. You can do it one of 4 ways here. You can do it online at ssa.gov. You can do it over the phone by calling the number there, 1-800-772-1213. You can do it in person by going to your local Social Security office, or we can do it by mailing. And we will help you walk through this entire process here. So if you are not drawing Social Security, you need to enroll in Medicare, just let us help you do it. This is our job. We can make it super easy for you and help you enroll online. Obviously, you're watching a webinar today, so that should be pretty simple for you. If you're not drawing Social Security and you enroll into Medicare, you're going to get a quarterly bill for your Part B premium. It's at $202.90 times 3 equals $608.70. So again, that's scenario two if you're not drawing Social Security. Scenario three, you're still working here and you're covered on an employer plan. If this is you, very important here. We take your employer plan and we take your Medicare options and we put them side by side. Common misconception here is if you're on an employer plan, I don't need to do anything. I run away from Medicare, don't worry about it. Time and time again, we see that the Medicare option can be more beneficial than the employer option. And even if you have an employer option, there are some gaping holes that you need to be aware of, and we can help address that. So no matter which scenario you fall into, we have expert guidance. We know exactly what you need to do in each scenario. Urge you to book a call to go over those 3 options and what to do. Now, when does Original Medicare start? It starts the first day of the month you turn 65. There is one exception. For example, if I turn 65 in June of 2026, let's say I turn 65 June 5th of 2026, my Medicare is going to start June 1st of 2026. The only exception is if my birthday is on the first day of the month. If my birthday was June 1st of 2026, June 1st of 1960, and I'm turning 65, then my Medicare would actually start the month prior. So if you're turning 65 and your birthday starts on the first of the month, your Medicare would actually start 1 month prior. Just this weird little intricate rule. If you have a birthday on the first day of the month, we'll help you through that. Now, what are the major exposures of Medicare? Again, one of the big myths out there is that Medicare covers everything. Frankly, it's just not true. So if you have Part A and you have Part B, you have some major exposures that you need to be aware of. and here's exactly what they are. Part A, you're going to have a deductible of $1,736 for each hospital stay. If you have a long hospital stay, it could get much higher and you could acquire a daily copay. Part B, you have a $283 deductible. Everybody says, Chase, no big deal. I can do $283. Sure. Now here's the one you need to be aware of. You have a coinsurance of 20% with no limit. So if you have a Part B bill of $100,000, you're responsible for 20% of that, or $20,000, and there's no cap on that. So how do I cover up these exposures? And that's what we're going to go through today. Because if you just have Medicare, again, you've got these major exposures. We do not recommend you just have Medicare and nothing else, or you are left exposed. How do we cover that up, or what are our different options? Medicare Supplements, Medicare Advantage plans. This is probably what you're getting inundated with in the mail. You're getting phone calls, you're getting solicitations, right? People are trying to sell you a Medicare supplement or a Medicare Advantage plan. And again, I can't say enough, there is no right or wrong here. And what we are going to do today is educate you on both of them so you can make an informed decision on what's right for you. Let's do just a brief summary of the difference between a Medicare supplement and a Medicare Advantage plan. So over here on the left-hand side, you have original Medicare. Again, you have that foundation, Part A and B. Now on original Medicare, if you're going with a supplement, you would add a supplement and you would add a Part D prescription plan to your original Medicare. And that would be the foundation of Medicare with that additional gap coverage. Now, you can also forego this and choose a Medicare Advantage plan. Medicare Advantage would replace your original Medicare. Medicare Advantage provides the same basic benefits of Part A and B and combines them into what is also known as Part C or Medicare Advantage. Medicare Advantage typically includes Part D coverage. So you'll hear it described as an all-in-one plan, and we'll kind of go over it and break it down. But you have option one, which is original Medicare. So if you're writing it down on a piece of paper, put a line down the middle of the paper. One side, you've got original Medicare and a Medicare supplement. The other side, you've got Medicare Advantage and your prescription drug plan included in that sucker, most likely. And we're going to spend the next couple minutes breaking these things down even further. So let's really focus in on a Medicare supplement. If you're thinking Medicare supplement, you're leaning towards Medicare supplement, you just want to know about Medicare supplement, here's what the Medicare supplement includes. Now remember, you have to pay the Part B premium of $202.90 no matter which way you go. Okay, so that is the standard premium, Medicare Part B premium, $202.90. Your Medicare supplement, you're going to have another premium on top of that $202.90. The coverage, that's going to be the most robust coverage. Medicare supplements are the most comprehensive coverage. Okay, if you want the most possible coverage, it's a Medicare supplement. Your network, you can go to any doctor or hospital that accepts Medicare in the United States of America. Networks, it's just one question. Do you take Medicare? Which over 98% of doctors and hospitals are going to take Medicare. So just about everybody is going to take your Medicare supplement. Then you would choose a standalone prescription drug plan. Pretty simple there. Coverage, robust. Networks, there's really no networks. Medicare Advantage, I'm sure you can guess, it's a little bit more of the opposite, right? Medicare Advantage now, Part B premium. Again, we're writing things down. No matter which way you go, you have that $202.90 Part B premium. Advantage plan premium is going to be lower, sometimes zero premium, but typically much lower than a Medicare supplement. So if it's a budgetary thing, Medicare Advantage is going to be the less expensive route. Now with a less expensive route comes more exposure. So the coverage, when it comes to a Medicare Advantage plan, you're going to have more co-insurance, more co-payments, more max out-of-pockets. It's going to be very comparable to a group plan where you have responsibility. Networks. Now most of these plans require a network. You need to go to a specific doctor or specific hospital in order to receive the best coverage. There's PPOs, there's HMOs, there's POSs, there's all different types of plans here and networks when it comes to Medicare Advantage. As I mentioned earlier, the Part D, the prescription drug plan, is typically included in these plans. And there's extra benefits like over-the-counter benefits, vision, dental, gym. So these come with some extra incentives, if you will. So if we put them side by side And if I were to just simplify this, if I had 30 seconds to explain the two to you, Medicare Supplements, you're gonna pay more for these plans, but you're gonna get more coverage. You're not gonna have networks. You're gonna see whoever you want. Okay, you pay more, you get more. Pretty simple, right? Medicare Advantage plans, you don't pay as much for these, but you take on more responsibility, more exposure, more risk. You pay less, you get less coverage, you take on more risk. Pretty simple when you really just take it and simplify it like that. Now, very important, no matter which route you go, again, Medicare does not cover everything, a big common myth. When it comes to cancer, heart attack, and stroke, we see them every day, serving thousands and thousands of people across the country. And the best way I can explain it, no matter what, you're gonna have out-of-pocket expenses when it comes to cancer, heart attack, and stroke. And cannot say it enough, you need to have a plan in place there. Skilled nursing, this is the biggest exposure that Medicare has that no one talks about. If you're talking with a Medicare advisor, with somebody that calls himself an expert in the Medicare field, and they're not talking to you about the potential risks of skilled care assisted living, you need to run for the hills. I cannot say it enough, this is the biggest exposure. Medicare only covers 20 days in assisted living or skilled care, and you have to check a couple of boxes for them to cover anything at all. You have to have a 3-day hospital stay, and you have to be improving. So you have to check those boxes in order to get any coverage at all. If you have a Medicare supplement, the Medicare supplement may cover days 21 through 100, again, if you have that 3-day hospital stay and you're improving. After day 100, very critical here, we'll highlight it down there at the bottom. After day 100, there is absolutely nothing that will cover you. There are only 2 options to cover you when you have a assisted living stay or nursing home stay after 100 days. That is your personal assets, which would be 401k, retirement funds, cash, your home, or you have a plan in place. That's the only way to cover it after 100 days. So Medicare will only cover 100 days if you check a bunch of boxes, which we see it time and time again, those boxes don't get checked. But after 100 days, you got nothing. So like I said, it's critical we have a plan in place. It says it in the fine print in your Medicare and You handbook that Medicare will not cover all expenses. Medicare only covers a assisted living nursing home care. After a 3-day hospital stay, you must be improving. It's all right there, but no one ever reads it. No one educates you on it. So people are left in a terrible position. And that's exactly why we have the umbrella coverage options. These cover, an umbrella coverage option is going to cover these major exposures. It's going to blanket up the cancer, heart attack, and stroke exposure. It's going to cover up to another 2 years of those assisted living or nursing home expenses. It's going to cover those major hospital deductibles. Okay, it's going to protect you from these gaps, as we say. So no matter what, we never recommend you choose a Medicare plan without umbrella coverage. And even if you're on an employer plan right now, you should have umbrella coverage. Okay, umbrella. You should have umbrella coverage. So make sure you identify, by the time we're done here, identify which umbrella coverage is right for you, no matter if you're going on a Medicare, no matter if you're staying on employer coverage, and it's gonna work with you as you transition on a Medicare, or if you go on a Medicare, like I said, we do not recommend a Medicare plan without this.
And as we wrap this up, I want to go through our 3-phased approach. So today, phase number 1, we're basically knocking out phase number 1. You're getting the Gruening Health and Wealth online content, today's educational workshop and seminar, and then you'll get a free copy of 64 Plus. And that's a #1 bestseller that will really take today's presentation in a book format and help you kind of slow it down, maybe circle things and take notes if you need to. And then phase number 2, the most important phase, is schedule your free consultation. Make sure that you get your individual questions answered. And we have a ton of incredible people at Gruening Health and Wealth that are standing by, ready to answer those questions. We've serviced thousands and thousands of Medicare beneficiaries across the country, and again, have that 5-star service and BBB accreditation to prove it and back that up. So we'd love to talk with you, would love to answer those questions, would love to help you plan for your Medicare and retirement transition. And phase number 3, that's our free lifetime billing and claim service. So we have a great full service team that's going to handle any billing, any claims, any service, and really provide you the holistic support on the insurance side that you're going to need throughout your retirement years. So can't wait to hear from you. Can't wait to answer those questions. And then again, I want to remind you that every year we're going to be there for you. We have our free annual reviews. So every year, October 15th to December 7th, that's going to be another chance to meet and make sure you have the right plan, not just this year, but for years to come.